many people, I imagine that some people want to hear this information and can't actually attend. So absolutely go ahead and record it.
Okay, thank you. We have an interpreter. How do I? Oh, hold on.
And I'm just assuming that the mic mute is what you'll be doing, Carrie.
So as far as questions are concerned, we'll just have them use the chat box and I'll let them know as soon as we get started. And Jody will jump in at the end and read the questions for you so you don't have to keep track of the chat box.
Okay, great. That'll help me a lot.
And
Erin?
Yeah.
Just in terms of the mics being muted when people enter the meeting, that's just so we always do that with ours. I just stuck that in out of habit more than anything else. So that's really more a reflection of what we do than anything Carrie may or may not be doing. Sorry about that.
Yeah, I think that's kind of, for a meeting this large, Colette, I think that's pretty standard just because not everybody remembers to mute their mic and it can create some background noise.
Okay. Are you ready, Erin?
I am, I'm ready. Sorry, I was closing my window.
Sorry. I want to welcome everybody to, hold on, just pin the, okay, sorry.
And Carrie, I can introduce my team if you just want to introduce me.
Perfect. So I want to welcome everybody to our webinar today. We are live streaming on Facebook. We're going to have Erin Frazier, the Special Education Director for the state of Maine, provide us with some information on individualized remote learning plans. We also are lucky enough to have Emily Poland joining us this afternoon. This was an additional add-on last minute. Emily is the nurse for Maine Department of Education. She's going to be able to answer some questions about masks. We do have an hour with this incredible team from Maine Department of Education, so we might not be able to get to every single one of your questions, but we're going to do our best. We would ask you to use the chat box on both Facebook and Zoom for your questions, and at the end we will have a quick poll if you could take some time to fill that out. And with that, I'm going to turn it over to Erin Frazier.
Thank you, Carrie, and thank you everyone for having me. This is an incredible time in our lives and in special education, and we've been working hard since March to try to help and support districts and families and children to make sure that, you know, everything is being provided that is possible to be provided. FAPE is not, the responsibility of FAPE is not ended. IDEA has no waivers, so we're just trying to support everyone in getting the best educational program they can, specifically our students who did not have great access to instruction remotely when we had our first switch into alternative learning. So again, we have today I'm going to talk about the Individualized Remote Learning Plan. You've heard other people mention this. You've heard Maine Disability Rights mention it, and also Carrie and Maine Parent Federation. We've been talking about this for a long time. As soon as March hit and all of these schools started across the country going out of the school setting to provide education, people started developing contingency plans. And so we in Maine wanted to really look at how we could develop a contingency plan because it's not contemplated by IDEA, because the IDEA was not developed with the pandemic in mind. It's really largely a document that we've worked a lot to kind of make it very specific in terms of what it does and what it doesn't do. So I just want to make sure that you know that. So we have a big team of people that have been working on this problem since February, March. Okay, so myself, I just got to the department in November of last year. We also have a veteran team of special service team members who are with us today on this call. Roberta Lucas, Federal Programs Coordinator, Mary Adley, David Emberley is our dispute resolution coordinator. Many of you may have spoken to him at the DOE. He's a very nice person to speak to. Emily Poland is a school nurse consultant, and we've been working pretty closely to try to understand PPE, personal protective equipment, and transportation, and traveling out of the state. So all of these things, Emily works for the DOE directly with the Commissioner's Office and the Center for Disease Control on trying to navigate really something that's never been done before, right? So we're in a different place than any other state is. Most of our schools have some level of in-person education that's happening right now. That's different than a lot of other states. We've been trying to navigate how to do that and just make sure that people have what they need to be able to access their education. We also have Leora Byris, who's a special education consultant, Anne Marie Adamson, Colette Sullivan, and Sarah Ferguson. This team works hard and has been working. They've been providing 5 days a week of technical assistance to the field since March. They've reduced their hours during the summer, and now they're continuing to an uptick in that provision as we try to navigate this together and try to provide the districts with as much technical assistance and support as possible to provide an educational experience that meets children's needs. So what is an IRLP? An IRLP is, again, Maine's version of a contingency plan. Contingency learning plan that was really, we got input from a lot of different stakeholders on this. We got input from Maine Disability Rights, from the Attorney General, the Assistant Attorney General here at the Department of Education. We also got input from special education teachers, from different parents to develop this plan. So it is a temporary plan. Again, it was not a contingency plan. This IRLP wasn't contemplated by IDEA. So this is a temporary plan designed for communicating agreed upon plan between the district and families and their IEP teams. It describes changes to a student's IEP, and it is designed because it's necessary to protect health and safety. So that's why we developed it. It's meant to be a temporary document in case of and in response to this public health emergency. Although it's not required by IDEA, we're recommending that teams consider these plans to navigate the uncertainties that are happening related to COVID-19. When we broke out in March, every district had a different approach of how to communicate what was happening to parents. And I know Carrie heard a lot about that. I heard a lot about that. Different districts were providing different information. They were providing it in a different method. They were writing letters. They were documenting in a written notice. They were making phone calls. They were emailing. So everybody was kind of, in the crisis and in an emergency, they were kind of approaching how we're going to agree upon what we're doing in this health emergency in 1,000 different ways. And so what we thought is it'd be great if, now that we are still in the pandemic, we are no longer in the emergency aspect of this. In other words, we've had time now to think about, reflect, and prepare how we can look at this differently so that everybody's using kind of the same consistent language as we're moving through this, and basically communicating with each other on what our expectations are if we go to a remote-only plan. So it must be developed with input during an IEP team meeting. You don't have to have an IEP meeting to create this document. You can communicate with members of your team, but it must have team involvement. It must have certainly parent involvement, but also educational staff involvement, administrative involvement. So your team is going to be involved in this. It can be discussed as an amendment to the IEP without a meeting, as I just discussed. And if it is done as an amendment, the written notice must document the parent input, and it must include parent input. So the last thing we wanted was for school districts to just hand you a plan and say, this is what we're doing in case of an emergency, because we want you to be involved in that discussion and to make sure that you understand what the plan is. Again, this plan is to communicate our understanding. Doesn't mean that we're always going to agree on every aspect of that plan, but it is a tool to communicate our understanding of how we're going to respond when things go south in terms of we have to disrupt school suddenly because of an outbreak. So we kind of narrowly defined how you could use this document. Again, it's not something that anyone has used before. I mean, the OSEP has the Office of Special Education Programs in the Department of Education, which deals with with students with disabilities has been looking at contingency plans that are occurring across the country. And kind of the biggest factor that they've considered is that you must have parent involvement in making these plans. So one reason you could use an IRLP, again, we're not requiring these documents. It's not a department issued document. It's a teacher and administrator generated document. But we agree that it would be a great thing for you to use if there is a sudden disruption to in-person instruction due to the pandemic. So there's an outbreak in your child's cohort. And after working with the CDC, you have decided that your cohort is going to leave school for a certain amount of time. And when that happens, you have a plan in place so that you know exactly what's going to happen when you have to leave school suddenly and go to a completely remote schedule. So this, we've given you this, and I will give you guys this PowerPoint presentation after I'm done, but there is guidance that was provided by the Office of Special Education Programs in March 2020 that really talks about providing services when these outbreaks occur. So that we've given you as a reference point. The second way you could use this document is, again, for a student that's being offered in-person services, but parents and guardians elect to have remote services. So basically, we're offering you this program. We think it should be in person, or we'd like it to be in person, or we'd love to work with your kid in person, but you don't feel comfortable sending your child to school. So, and the other key here is that your district has to provide an option of remote learning. Some districts are providing an optional remote learning, and some districts are saying, you know, we're offering full school, that's our offering. So if your district is offering an option of remote only, then this would be a great use of this plan as well. And so if you choose an online program, the exact type and amount of services and identifying the IEP might not be as easily provided as if your child was in person. The IEP team might feel like the best program for your child would be in person, but you have the right to say, you know, I'm just not comfortable sending my child to be in person. So then your IRLP would be to describe the services that are happening when you're having a remote only program. Your IEP would indicate what you would be getting for services if you were in person. Your IRLP would be identifying what you would be getting to try to support what that is. But it might not look the same because, well, let's say that your child can't access online learning for 45 minutes in a row. So it's not going to look the same as if those services were provided in person. It could be that there is a small group instruction that your child normally attends, and because there's no way the district has to provide that to your child within that group, they're now going to be providing it in, individually. So those services may not look the same, and it might also be harder if your child's not in person to be able to really assess, although we are learning more and more how to do this, how to assess skills online over the internet. So we'll learn this school year, when we're coming into school, we really want to take a look at where kids' learning is at, because we know that in many cases there has been learning loss, and that there's been slide, and that there's been regression. Not for every student. Some children thrive in an online virtual setting, but some students have lost some skills. So again, this IRLP would be to try to get to where your child is at and how we're going to provide you remote instruction. And it may look slightly different because of the fact that the school can't provide the services in the same manner as if they were in person. So that's something that the team will have to kind of work through and agree to. It will be different district to district depending on if your district has hybrid services available to them. So if your school is, for instance, on a schedule where they are, 2 days in person and 2 days remote, your remote options have probably expanded because you have a lot of teachers working on remote instruction. And if you're in a school district where the children are going 5 days a week full time and all the teaching staff is working with children 5 days a week full time, the services that they offer might not be as much as what a district who's offering remote services could provide. So those, like I said, those conversations are happening between parents and districts right now. They're really hard to navigate. There's a lot of things that go into those conversations, such as how your child does with online learning, how they interact with online learning, can they do group learning? There's two different types of online learning that we use. These terms are asynchronous, meaning it's a recording of something, and synchronous, meaning that you are kind of, talking with your teacher live and in person. And so those kinds of things are different at every district level. So this second reason to use this plan would be to kind of look at that aspect of I'm choosing something different, and now we're going to figure out how we can figure out first where my child is performing, and second, how we're going to provide services to those children in an online virtual environment. Although the determination of when prior written notice is required depends on the particular facts and circumstances, OSEP encourages schools to ensure that parents are fully informed how their child's special education and related services are being addressed during remote learning. Because we want this communication to be really clear and so that you have a really good understanding of how your services are being required, we think it's really good to document them in this plan. And this is where the procedural safeguards in the current COVID-19 environment, we've given you this as a guide, as a reference point to use in relation to this IRLP. So the IRLP, you'll see it in your child's IEP added as an accommodation. And so what you'll see is the individualized remote learning plan. And then the location would be general education or special education remote. So that would be the remote location. Remote learning can be either general education or special education, as you can probably imagine, because sometimes your remote learning, your synchronous learning, where you're tied to a general education classroom, is in the general education setting. And sometimes you're getting specially designed instruction remotely, and that would be your special education setting remotely. The other thing we wanted people to consider was that some accommodations in remote learning might look different than they are in person. So in remote learning, you may need to access remote learning supports. You might need to access some coaching from an adult to do remote learning. You might need noise canceling headphones, visual aids, daily check-in, and then you might have to reduce the amount of work that people are doing in a remote context. So we wanted people to start thinking about the fact that there are some accommodations that would be specific to a remote learning environment. Again, not something that we've ever considered in IDEA before or in an IEP. So this was kind of our way of saying we wanted everybody who uses these plans to kind of use similar language and use this as an accommodation. We want these plans to be fluent and flexible because they may change. And when I review the plan with you, you'll understand how they might change. So we wanted to make sure that this was an accommodation to support your child. We're still recommending that the location of special education and the frequency of services for your SDI remain kind of the same. So we still think that special education, 210 minutes a week, some of that can occur remotely and some of it can occur in person. So we wanted to kind of maintain the essence of the related services and special education services to say, this is what we think you need based on your disability, instead of getting into the remote versus in-person location here. So again, this is just another related service example. If your child's getting speech or OT, that might be in a special ed regular education setting. the amount of time per week. We have cautioned people against potentially using sometimes number of times a week, because it might be that you think that this child could use an hour a week, but if you're doing it remotely, it might, you might have to split it up into smaller segments. And so instead of trying to navigate that, especially as we're just starting to try to understand what that looks like, we wanted to just look at how much time we think we need to spend on the skill deficit during the week, and then figure out how to provide it. So this IRLP in this document is broken up by section, but in the actual IRLP, it's just like a mini IEP. The IEPs used to be on a portrait, a landscape orientation. So this document is on a landscape orientation, but it's one document. So it's just broken up for the presentation. So the individual remote learning plan, we have a date implemented, and really this is just to clarify for people what instruction will look like during this public health emergency. We are still in the public health emergency, and so we wanted to make sure that there was an implementation date, so that if you changed anything on this plan, you could simply update the implementation date, as long as everyone agreed on it. And then you would have kind of a documentation of how things are, where, when, and where, and how they may have changed. So we have a communication plan as part of this. And I think this is, every team member should agree on how much time they'll need to communicate. And again, this might be something that we change over the course of the year. So for instance, we're going to start with 2 times a week, we're going to call the parent. The case manager will call the parent. And then as we get more comfortable with our plan, we may reduce that to 1 time a week, because you know that all you need is a simple wrap up, checkout at the end of the week, and just making sure everything's going great. Or on the other hand, you could say, this isn't enough communication. I'm really going to have to check in with you 3 times a week, so that I make sure that I'm on board with everything that's happening. So that's why there's some flexibility built into this plan. Again, it's not changed without parent input, so you should be kind of every step of the way kind of being communicated about how you're approaching this. Everybody has a role in the team, and everyone is going to agree how much they need to communicate with parent. And the parent is on here too, and anyone else, in case, for instance, you're working with a care provider, like an after-school provider, and they need to know what an assignment is to be able to help a child. So we have kind of built in some flexibility around who needs to be on the communication plan. So the services, the goals, and actually this is missing a column. I'm sorry, we just fixed this. I told Carrie we just fixed this. This is, the services are the goals here, and how the learning is verified will be in the red. There would be a column in the middle, and it might be on my next slide, so I'll fix the slide before I get to it, that talks about how you're working on the goals. It might be on the next slide. It's not, okay. So I opened up the wrong presentation. There should be a column in the middle here that kind of discusses what the learning will be based on the goal. So let's look at math. And the goal is to understand the concept of place values from numbers 11 to 19. So in the middle, in this column that says remote learning, and again, I apologize, we just fixed this and we should have the right PowerPoint presentation, but these kinds of things happen to me all the time. You would just be verifying how you're going to get to that learning. So you're going to be looking at, maybe doing 20 minutes of a certain math activity 5 times a week. You're going to be doing 30 minutes of a math app 3 times a week. So that's going to be all spelled out for you. And then how we're going to make sure that they are learning this is going to be in this how learning is verified. So there's going to be work samples in the binder. There's going to be a Google Meets contact log, and there's going to be data when that's available. So again, we're going down through all of the speech therapy. These are the goals on the left. The validation would be on the right, how we're going to measure it, and then there would be a middle column there to describe what the activities were specifically. Okay, so the specific column would be speech language we're going to do, 2 synchronous learning sessions, 20 minutes at a time to practice, and then I'm going to observe 1 synchronous group experience to make sure that the skill is going to be carried over. And then you're going to be talking about what your SDI is. Again, this might look different in a remote learning than it would, if you were in person. So if you're in person 5 days a week, 32 hours a week, you have a lot of services that you can provide during that time. If you have less learning hours, then there is a difference and a variation in how you're going to approach what you're going to give. And then again, when you look at online learning, you have to know that some children can't participate as fully in online learning as they can depending on their age and developmental challenges and their specific disability. So it was created by a school district in Maine, and permission was given from that district. We had a subgroup of people that worked on this document, and we just wanted to make sure that you understood that this was kind of a lot of educators working on this and looking at what we could be providing as a document that would capture everything. So we worked on that for a long time. All right, so I will take any questions. I want to remind people that Emily Poland is here as well. And so I know that there's probably a lot of questions here, but yeah, I don't know how you want to do that, Carrie, if you want to split them up between Emily and myself.
So we have some questions specific to the IRLP. So Jody can start reading those off to you now. And I think those are going to be questions that you will answer, Erin. And as Jody reads those off, I'll monitor the chat box for any questions that come in for Emily Poland in regards to specifically masks and accommodations for face shields and those type of things. I think that's probably the best way to manage it. So we'll tag team. So I'll turn it over to Jody now to do those questions.
Okay, so our first question is actually coming from Facebook. I want to make sure that we include this and don't forget because it's not on this screen. But this parent was told by the special ed department that safety trumps idea, that's in quotes. Is that true? In context, my son needs adult supervision to access a FAPE. But because they are only having students 2 days in person and 3 remote, 1 day with no teaching at all, they say it's acceptable he has no adult supervision provided by the school because they can't provide that safely due to limitations on how many kids can be in the school at one time.
So that's a really long question, Jody. So that is something that is floated around there. And what I want to say is that schools have to pay attention to both IDEA and public health, right? So more important to anything is that people are safe and healthy. I mean, I think that we would all agree that human beings need to maintain safety and health in order to be educated. But that doesn't mean that your IDEA rights go away. It does mean that there are some things where schools have to consider school safety before they consider special education. The other thing is that staffing is an issue. It's an issue for districts because many people saw there was an emergency certification that came out. There's a lot of people that have left education and we're dealing with the teacher shortage. So it's never, you never want to hear your district just say, it's not possible. We don't have the staff to do it. But you really have to work to understand the parameters around what is possible. And then the focus and the goal should always be, we need to do what we need to do to support your learner, right? So we need to focus on the IEP. We might not, if you're in a remote learning environment and you're not getting as much as you were in person, we may have to look down the road at some point when we do get back to more healthy and safe interpersonal education and look at how we need to make up for some of the learning that couldn't happen because of this public health emergency. So that's how I would say it. It's not really that public health trumps IDEA because they're both really, really important. Life or death, health is a little bit, that's like a standard that everyone pays attention to. And also no one's been in a pandemic before. So what I'm telling districts and what I tell parents is that it's really, you know, there's a lot of students everywhere who aren't having an experience that is particularly the best experience they could ever have. So I have plenty of friends who have children who have disabilities and who are general education students who are all saying the same thing. Like, this isn't as much as I want to have. Like, I wish I had a school year where I could walk into it and all my teachers are there and all the kids could be in the classroom, but we have to deal with this public health emergency. So the thing I can say is that I'm just hoping that everybody is, I know that we all have to do the best we can, especially for some learners who don't feel safe coming into school. Maybe they have a medical situation, maybe their parents aren't comfortable with them going in, and how are we going to provide the most that we can to provide their faith? I don't know if that answers the question. There's really no good answer to that question because of the fact that we can't overlook the public health emergency to provide faith. We can't do that. And we also have to understand that schools are trying to do both at the same time.
Okay, so we have another question. This parent says, as a clarification, the IRLP is for children whose parent chooses remote over face-to-face or hybrid ? For children doing hybrid learning, can an IRLP be considered to support the unique needs during the remote learning times?
The IRLP can be used to talk about the unique needs of a remote learning time. The hybrid IEP, however, will most likely encompass all that is happening for your child. So maybe you have to add a new goal around executive skills around interfacing with remote instruction. That might be something that your team has to do. But you can use it. You can use it to delineate what's happening during remote instruction. This tool, though, is really only what if we have to suddenly close because there's an outbreak. And so I've been having my hybrid plan. It's well documented in my IEP what that plan is. And suddenly I'm going remote. And so now I know this is the plan that we're going to have. It's a temporary plan. And then the other reason for this is that we are choosing to go remote, even though the district is offering in person. And so we're making a plan because those two things might not be the same program offering. So again, it's not a required tool. You can do all of this documentation in a written notice. I think it's helpful to have a visual that says, this is how frequently I'm going to communicate with my teacher. This is how frequently I'm going to communicate with the OT. This is how frequently I'm going to communicate with a speech therapist. And this is what I know the assignments are every week. And we can talk about this plan and say, it's not working, more here, less here. How can we fix it? How can we do more with less, potentially? And so that's what I would say. I mean, you can use this document for a lot of things, but basically I think it's a very good form of communication. It's a plan of communication that you can be really clear about what's going to happen when you're remote.
Jody, hold on for 1 minute. You missed one question that was above that question. I just want to make sure it gets addressed. This is why we have multiple staff with eyes on the chat box.
I'm just glad you're managing the chat, not me.
It's working so much for us on our side. She says, I noticed that the accommodations expire with the IEP. Can you individualize dates to make a review more frequent, perhaps monthly?
Yeah. Yep. Yes, you can. You mean on the accommodation section? Okay, I think I know what you're saying. So you're saying that because the IRLP is listed in the accommodation section, it has the IEP goals on it. You know, what you might do in that case is just, put as an accommodation a monthly check-in on the IRLP and add that. Because again, you're going to be doing that throughout the duration of your IEP.
Yeah, that makes sense to me. And when we've fielded this question from parents before when this process gets started, and it just makes sense when you're putting an IRLP together to do a check-in because this changes on a daily basis. So what's happening today might not be happening tomorrow. So just to check in when people are comfortable. Okay, I'll take Jody now.
The next question I think came after the slide when you showed the matrix and it said like 60 minutes a week of service as opposed to the number of times per week. This parent says, are service times not guaranteed if a student is participating in only remote learning?
No, those services are what you think you can deliver, right? So they're what you think you need. And so those services are what you need to deliver. You, even if it doesn't say like 2-3 times 20 minutes a week, you still have to fit 60 minutes in for the week. So it's not that you can provide less on the IEP. If you have a remote only plan, you might not be able, you would say upfront with your team, hey, this child can't participate in 1 hour of services remotely. So during this time, we're going to be doing, maybe the child can only do 5 minutes, 5 times a week, whatever it is. But the IEP is going to indicate what you think the child requires. And so in that case, when you're choosing remote only, you could have more if you were actually in person. Mostly probably because the child could participate for a longer time in an in-person, depending on the child, if that makes sense. Does that make sense? So yeah, whatever you put on the IEP, those services are what you're recommending. This is what you really need. Now, let's say your IRLP, because you're choosing remote only, is less than that because of the fact that the child can't tolerate it. At some point, you're going to come back together as a team when we resume in-person services because this public health pandemic emergency is over, and you're going to say, we couldn't get in as much as we wanted to get in. So right now, we're going to look at COVID compensatory services. We're going to look at how do we need to give more at the back end of that to make up for the fact that we couldn't give as much during the pandemic, if that makes sense.
Another parent has a question. How do you account in a virtual setting when a student requires one-on-one support and has that written into their IEP?
Well, it's very hard to, and I've seen it done, actually. I've done some observations of some synchronous learning in a classroom with students with intellectual disabilities with one-on-one aides in that classroom. It's very challenging to not have that person right next to you, right? So if you need that person right next to you, it's also probably going to be challenging for a school district to send a human being into your home because they have to, per their labor laws, they have to protect that person from a pandemic as well. So it can be done. I think that sometimes it can be a one-on-one check-in, and sometimes it can be if the child is able, it can be like a side chat conversation. You can do something like that, like a private chat. You can be checking in with this kid and providing explanations or making sure they're on board or making sure they're paying attention. But it is very challenging. We've been trying to navigate this for a long time about the in-person services. And we are looking at other types of services that are happening in the home that might be able to help, maybe potentially medical services, or that's not always an easy thing either because nurses have their roles and PTs have their roles. So it's a very complicated question. And I can tell you that it has to be an individual decision and that there's no really good answer in terms of if your child needs that direct human next to them to participate in their learning. It's really going to be individualized based on your district and what other services you have on your IEP that might be supporting.
So Erin, I just want to also throw out there the alternatives through Maine Care that are available as well for some of these individuals. Maine Care did come out, and I believe it was in conjunction with MDOE in offering some guidance. And we did put it up on our social media pages, but it's important to note that if your child receives in-home community-based supports, Maine Care is now allowing for that individual to do some school-based work and be reimbursable with that child so they can provide some one-to-one support for virtual learning now. Also, if your child receives school-based Section 28 services and your district is contracting with a provider to provide that BHP in school, those providers have been cleared to provide in-home support as well. So It might not fit the needs of all of our students, but those are two options that are available to some students and may apply in some of these cases. So I just wanted to provide that as well.
Yes, thank you. I am very glad you said that. I have that document on my website. That was a big win. Not only can they provide school-based services through an agency in the home, they can also be the same provider. So it used to be that if you had 28 and 65, they had to be different people, and now they can be the same person.
Right,
So
that was another part. Thank you.
Yeah, it's very, very, it's a great thing. The only problem with that is that we don't have enough staff to, we have wait lists for these people. And I'm hoping that, you know, people will rethink their, you know, but that's the only drawback to that, is that there's sometimes, as you guys know, a big wait list for those services.
Yep.
We have another question from Facebook I want to make sure that we get to. I was told if I chose remote learning over the hybrid model that I would be denying my son FAPE. Is that true?
No, it's not true, because if your district is offering a remote option, and you are accessing some special design instruction remotely, you're accessing your free and appropriate education. Would it be as robust as it would be if you were in person for 32 hours a week? Probably not, because children can't do 32 hours, I mean, adults can't do 32 hours a week of online anything, you know. So I think it's not true that you're denying yourself FAPE, because we're always going to have that as your free and appropriate public education is always on the table for you. And you can always have access to it. It might be that during this time, it's not as robust as you would like it to be. And there will be a time where we have to increase services at the back end of this to compensate for that.
I just want to address a quick question that came up in the chat box, because it talks about exactly what we were talking about, the one-to-one support from Section 28 workers. It's asking if they can request more hours from the Section 28 worker to make up for missing one-to-one school time. So in navigating that situation, I would say if you're asking for more hours to navigate one-to-one school time, it's most likely going to get denied. However, if you phrase it in a way in which you're trying to provide your child more supports in the in-home setting so that they're able to access their education and relate it back to their goals on their individual plan through the Section 28. So some of those goals can be self-advocacy. It just depends upon what your goals are for that child. And you can relate them back to that plan that you have for your child, for not your IEP, but for your in-home supports, then you're more likely to get that accepted. But if you go to your Section 28 worker and say, I need more support for one-to-one school, you're going to get denied. So you got to get a little clever about that. And if you're wanting to call our offices, we can help provide you with some one-to-one support in that wording.
Remember that Section 28 isn't typically designed to provide educational support. It's designed to provide functional support. But
Right.
Education can be functional, right? Like completing a routine, an academic routine independently can be functional. Learning how to tolerate wearing a mask is incredibly functional right now, if that's a goal that your Section 28 plan has. So in the Section 28 world, you have to think about how you need to access your education to be functional. So it's either attending to a routine or integrate, you know, so you have to think about if you say, I want more school, that's probably not gonna equate in the Section 28 world.
It's all about the language that you use. Go ahead, Jody.
Keep going with the Facebook questions. My child has speech therapy 90 minutes a week in a small group. How will school-based speech therapy work in a small group remote only? Would this pose a privacy issue since it's remote learning?
So it's not a privacy issue. You can do synchronous learning online, but there are some parameters that you have to be concerned about, right? The first is identifiable information and making sure that people don't have access to that. It's called personally identifying information. The second thing is there has to be some norms about how you're going to participate in that. Like if you have children who are going to be participating in a small group, you want to make really sure that the people who are participating know that the child should be alone, that they shouldn't have a lot of other people there, that the people who are watching children shouldn't be taking pictures or sharing images, so there's just some parameters that we've been providing districts on how to do that confidentially. It's not breaking confidentiality to be in a small group instructional, as long as you make sure you understand what the home environment kind of parameters have to be safe and respectful for all people. So you just kind of have school districts are making agreements with families and saying, you know, we need to have your child in a place without a lot of people in there, and please don't take a picture, and this is going to be private, and please don't share anything that you may see. Or so it's just really the same thing as being in a small group in a classroom setting, except for the fact that we have to kind of monitor that home environment.
Just a quick interruption. I posted that guidance from MDOE and DHHS. I posted a link to the guidance in the chat box for everybody to have available to them.
And I'll send you the PowerPoint right after this, Carrie, so that they can look at the actual column. Anyway, I'm sorry about that.
No worries. We will post it when we on our website when we get the link up there. So no worries.
I think we're almost up to speed. It looks like we have a follow-up here on Zoom following up on my other question. What if the school is asking me to have his Section 28 BHP support him?
I mean, as long as it's in alignment with the child's goals on their Section 28 plan. And again, there's a lot of functional goals that relate to completing academic tasks. So I'm following directions. I'm compliant in my behavior. I can use tools independently, such as a mouse or a pencil. So as long as they're in alignment, you can work on some functional school-based activities with your Section 28 worker.
Okay, and if the child is remote learning at home, are they provided the AT that may be needed to optimize learning?
If it's associated with their IEP and they're required to have it, then they have to be provided that. And I'm assuming you're talking about assistive technology. Okay, just want to make sure.
That's all I have for questions. I don't know, Carrie, if you've gotten any others. Oh, I'm just getting some more from Facebook. So 1 second here.
And we still have Emily available to us if anybody has questions about face masks.
I have a question on Facebook. If a school doesn't have the staff to send an ed tech to our home and I am willing to hire someone, would it be acceptable for the school to pay for it if my son doesn't need to be remote due to health reasons, but because it's a family preference and we don't feel safe sending him?
So hiring is not a decision you can force on a district. So you can't ask a district to hire somebody that they wouldn't employ because they're not really set up contractually to do that. I mean, I think it's a great idea. Have the conversation if you can do that, but because it's not a staff person that a district would be necessarily working to hire, that would be challenging for them to provide compensation to you for that.
Emily, I have a face mask question for you. Actually, I have 2 questions for you because it's one that we've been getting phone calls on today. And another one just came in. I'll kind of group them into one question for you because I think you can probably answer it with one fell swoop. But the question from the parent is, what if my child cannot wear a mask due to sensory issues? And the question that's being asked by families today on our phones is, my school district is saying that they're masks only, but I've seen in the MDO guidance that accommodations can be made if there's a doctor's note. Why is my school not allowing my child in with a face shield?
Yeah, so according to our Maine DOE, yes, accommodations should be made. Face shields are acceptable for those with a documented medical or behavioral challenge. So for the person that is having a hard time with their school district, I guess I would go back to the school and talk about what plans they have for accommodations, because that is listed as an acceptable accommodation in Maine. So if your child can't wear a face mask, then work with your school. What kind of documentation do you need to provide? So does the child have an already diagnosed medical challenge that the doctor can just say, yes, this it would be appropriate for this child to wear a face shield instead of a face mask in school. But that is allowable within Maine schools.
Yeah, so you definitely want to, you know, get your district administrators involved in that. It is an acceptable accommodation. There are some parameters, and sorry, I'm jumping in, Emily, about wearing a
Go right ahead.
shield because I talk about masks and shield a lot. There are some parameters around being able to maintain distancing with a mask and with a shield. So you do need to maintain 6-foot distancing with the shield. That is an allowable accommodation in our state. So if you're having a hard time with that, you should definitely, what do you say, Karen? You go up the chain.
Up the
right?
chain of command, yes.
Right.
Work up your school district's chain of command. The other issue that we've heard about is if their child can't wear a mask, is it okay for the district to say that they can't come to school at all, or should the district be trying to work with a child in a room in the building, if they have the space, with a staff member to try to teach them or get them to a point of wearing a mask?
Well, I would say at first they should be wearing a face shield. So if they can't wear a mask, they should be wearing a face shield. If they can't provide a face, if they aren't even capable of wearing a face shield, then they should be working in a private room, right? So the staff that have to work with them would have to wear additional PPE. They would have to be having a face mask and a face shield in order to work with the student in a private setting. So it could be a private room in the school, but it has to be one-on-one. There can't be any other students there.
And we've been hearing the same thing. Some providers are refusing to write medical notes for individuals. That's sort of outside your parameters as MDOE. You can write the guidelines. What we're telling parents is a lot of these children will have multiple different doctors that they're working with. And so I know primary care physicians are being inundated with requests from all parents saying, there's some parents that just don't want their kids to have to wear a mask. And so they've just sort of put down a general rule of thumb that regardless of the child and their ability, they're not writing these notes. So we've sort of told parents you should try to work with multiple doctors. If you have a cardiologist, a genetic specialist, a pulmonary specialist, all these individuals who might be able to speak specifically to your child's disability, it can be a medical note from those individuals as well. It doesn't have to come from a primary care physician. As far as some doctors' offices refusing, it's frustrating. I don't know that any of our agencies can put pressure on. I know we did do a webinar with the Maine AAP, and we have expressed those concerns to the Maine AAP. And if you have concerns about primary care physicians, I would say, contact the Maine. So I'm sorry, the Maine AAP, I should know better than to use acronyms, is the Maine Academy of American Pediatrics. So I would contact that office and express your concerns. And those might be the people that have the leverage to make changes in that area.
I did want to mention that the Maine AAP, so the Maine American Academy of Pediatrics, does have a template letter that other doctors can download right from their website. Anybody can download from their website under their school resources on their webpage, a template note for a mask exemption.
I have another question from Facebook I wanted us to make sure we get to. Is the school allowed to send people into homes at this time? And I assume the parent is inquiring about maybe ed tech support within the home.
Yeah, most schools, I think all schools will have challenges sending school staff into a home because they have to maintain the safety of the staff member as well as your child. So it's not that schools don't want to, help your child and come into the home, but there are a lot of labor laws that are around the staff. Just like if you worked in an office and someone required you suddenly to work in the home, it's not what is in your contract, and you have a right to be healthy and safe as a staff person as well. The workaround for that is if there's other types of staff people who are working in the home, medical staff, Section 28 staff, Section 65 staff, other agencies that are typically working in the home and they're not prevented from working in the home right now. So that is probably the best bet. The other thing that you should consider is an alternate environment other than the home. And I know that that's very challenging for districts and families, right? So you want your child not to be in a school that can't staff your home, but there might be a third party setting. So you might look at something like that. The other thing is, while the weather's nice, doing outdoor experience while you're working on trying to get that child back. So it's very complicated to try to send school personnel into the home, and most districts are, don't have the capacity to do that based on their. Yeah.
Sorry. We had an IRLP question in regards to if a student's doing all in-person learning, is it recommended that an IRLP be created? And it's my understanding that if you're concerned about you going 100% remote at all, then you should create an IRLP, correct?
I think that it may happen that there might be a sudden school closure. And based on our experience with last March, we didn't have a mechanism for clearly articulating what would happen in that event. And so that's why we're asking, it's not something you have to do the first week of school. I mean, there is already a school that's shut down, but you want to be thinking about, what happens, and if October, my cohort has somebody in it that's COVID positive, and now they're sending my child's class home for 3 weeks or 2 weeks or 14 days or however long it needs to happen. I want to know what is going to happen during that time with my child's learning, and I want it to specifically align to the goals of the IEP. So that's why you might want to have an IRLP. You also can document that in a written notice. If it doesn't have to be an IRLP, it's not mandated. The benefit of the IRLP is that it's clearly visually laid out for you. So if you are wondering about math, you can look at a column versus going back to your written notice and trying to read where you talked about math in remote only context. So that's why we wanted to make a plan that was clearly communicated, parent and team driven, and that could be fluid and flexible in the case that you have to change something small. Like, you know what, he can't do 30 minutes of Braz Kids, so we're gonna do 20 minutes and see if he can do that. So it's not a big change, but it's still working toward the goal. So yeah, I would recommend you, in the event of emergency, you should have a plan, instead of trying to create the plan when the emergency happens.
Can an IRLP be accessed by kids who have 504s?
I don't see why not.
And
I know Emily has to leave right at 4, so Emily, I know you have another. I can stay on for a few minutes though, Carrie.
Just wondering, Emily, if you could have a quick second. Somebody's asking, is there a set amount of time a student must wear a mask or face shield prior to being granted permission to return to school? So in other words, if you're working with the student on wearing the face mask, do you have to prove that or face shield, do you have to prove that they can wear it for a certain amount of hours before they can return to school?
Well, in order for them to be in a classroom with other students, they have to wear the face shield whenever they're with other students in a classroom. It would depend on local ability to have a private setting for just one student, I guess, if they were there without either the face mask or the face shield. So I can't really speak to a certain amount of time. I don't know if Erin, you want to speak to that at all?
Yeah, I mean, I've thought about that a lot. I mean, some kids will tolerate a face mask because they want to be around other children. And so that's the only criteria. It doesn't have to be time. It just has to be their ability to be able to tolerate that. And so we do embed mask breaks in there, right? Like we should embed mask breaks every day for every kid. They're going to take off their mask when they eat snack. They're going to take off their mask if they can maintain a certain distance on the playground. But I think that there's not a time requirement. You just have to work really hard to say, little Johnny can tolerate a mask for 10 minutes. So we're gonna put him in the class for 10 minutes and we're gonna walk out of the class and take the mask off in a separate location. So that's really all you have to do, is just make sure that when they're around other children, for their safety, for other children's safety, they have this covering. and then you plan around it. You can do it in any amount of time. It probably, you know, wouldn't make sense to only be able to tolerate a mask for a minute and be able to go into a classroom. But I think if you have several minutes together, you can do some kind of involvement, and then the school will be working on increasing your tolerance to the amount of time that you can tolerate that mask with embedding breaks in there. So I wouldn't say it's a time, it's just kind of, it has to be enough to make it easy for a child to be in a classroom and transition out.
Great. Thank you, Emily, for your time. I know you have to run to another meeting. Erin, if you have a few more minutes, we have a couple more questions. I'm also just going to launch the poll while we answer these questions. So if those of you that are participating or attendees can take the time to fill out those questions, that would be great. Erin, what if a child cannot do remote learning for long periods of time? So will there be help for that?
You know, I'm assuming that if the person can't do remote for a long period of time, that they're going to be trying to increase the amount of time, right? So they're going to, whatever school that you're in, they're going to increase the amount of learning you can do online. And I'm assuming that the person who's asked this question is choosing online instruction, but then their child also can't tolerate it for very long. So we'd be working on increasing that exposure and duration in a remote setting. If they're in a hybrid setting and they can't do a lot of learning remotely, you're going to try to push a lot in during your in-person days, and then do some other activities on the remote days where you can, again, try to increase that capacity. Some kids are doing fabulously on remote learning, and some kids can't do it. They can't.
Yep. There's a wide variance.
Yeah.
Can a student be told that they must be either entirely mainstream with support or placed entirely in the self-contained classroom?
No, that's an IEP team decision. So it's, you know, I mean, as a parent, you know, Carrie, I've heard you talk about this before. You're making decisions about your child's education based on a lot of different variables. For instance, someone might say, it's more important for me that my child's in a mainstream classroom and learning the social skills and behavioral skills that make group instruction a thing than it is for me to take them out and separate them from everybody all the time to work on these skills that, if I can't interact with other human beings, isn't going to be helpful for me anyway. So it's never it's always an individualized decision, and it includes your own perspective of what you want for your child. So you might be a parent who is really just thinking about academic skills and lost skills and want to focus on that. So it's not a blanket statement of this or that. You're really trying to work the team to say what's important to me, what's important to my kid too, because they have to be happy doing this, and how are we going to adjust the IEP, knowing that things are still clearly unusual and not similar to what they were like this time last year. So it's it's really going to be challenging to kind of get that balance right of what mainstream you want to do. Do you want to do all of your mainstream remotely and all your specially designed instruction when you're in person? Would you rather have the child in person, even though they might be getting less specially designed instruction remotely? So those are conversations that you have to weigh what you know about the child, the disability, how the district is approaching learning, how they can tolerate remote learning, and what's important to you. And also, I like to put the kids' perspective in there as well, what they would like to do as well, as much as you can.
Thank you. So the ASL interpreter has to leave us shortly. I just wanted to address one question. I think the answer is local control, mentioning why can't all districts use the same documentation for IRLPs? And I believe the IRLP is guidance from MDOE, and because we are a local control state, it's up to individual districts as to how they want to implement that. Is that correct, Sharon?
Oh, you say me? Sorry.
Yes.
Yeah. Yeah, well, we're asking people if they are using an IRLP to use it with some consistency. You know, so you want to put it as an accommodation. We want to make sure that you have these elements in it around communication and our expectations. And we're recommending it highly. And I think that if you're a parent, I think, and you say, gosh, this would really help me understand what's happening remotely. I'm hoping that your district will say, yeah, let's develop one of these plans, because I think it'll be great for us to be on the same page. So it's not a requirement document, but we are recommending it highly because I think it's going to just increase our understanding of what we're all agreeing to do.
Awesome. With that, we have managed to tackle all of the questions. So I want to thank everybody from MDOE for joining us today. I want to thank our ASL interpreter for being available to us today as well. We will have the webinar up on Facebook, recorded as soon as we end, and it will be up on our Facebook page with the PowerPoint presentation from Erin as well by the end of this week. Just check out www.mpf.org. And Maine Parent Federation is available for any other questions or concerns that you might come up. So just give us a call in the office. I want to thank everybody for joining us today. Again, thank you so much to everybody at MDOE. We know that we're hopping from one Zoom meeting to the next, and this is the very first week of school, so you're all incredibly busy. So thank you again for being here today and for your time. And everybody have a good first week of school. Good luck.
We're all with you. Fingers crossed.
Thank you. Have a great day.